My name is Dr. Jeff Dolgus from Buffalo TMJ. And what I'd like to do today is share with you a brief overview of my understanding of TMJ dysfunction in terms of where it comes from, why it happens, and what you could do to overcome it. So first, I think it makes a lot of sense just to define our terms. So we've got TMJ, which stands for temporomandibular joint. Now, this is the place where your skull comes together with your moving mandible or jawbone. And we each have two of them, and they're right in front of your ears on either side of your face. And the second part of that word, dysfunction, means that something is not working properly. So TMJ dysfunction means one or both of your jaw joints don't seem to be working properly. So why does this happen? Well, I want to think about this very simply, and this is the way that I try to describe this to my patients. Any joint in the body will cease to function properly if it's overloaded or if it's not used at all. So we have to find a balance between using a joint enough under the proper mechanics and not overloading it or overdoing it and risking damage to those structures. Now, as far as the jaw joint is concerned, the jaw joint is the part of your body that allows your chin, your mandible, to move up and down. And what's the primary function of the mandible moving up and down? Well, it seems to be in order to mash the teeth together in a repetitive motion in order to make big pieces of food turn into little pieces of food, what we call chewing or mastication. So the first sign of TMJ dysfunction would be you're having difficulty chewing. Whether that means that you're having difficulty opening wide enough to get the food into your mouth, or you're having difficulty after the food is in there, chewing the big pieces up into little pieces. Now, some common symptoms that people have, which are characteristic of TMJ dysfunction, are pain in one or both jaw joints or on the sides of the face or the jaw, inability to open wide, meaning you can't open wide enough to get a normal sized piece of food in your mouth, or noises in your jaw joints, in one or both joints, when you're going through normal daily activities like chewing and swallowing. These types of noises might be described as clicking or popping or sometimes grinding. Now, it's important to understand here that when you swallow, there's a normal clicking that happens, and this has to do with the stretching and relaxation of the muscles around your eustachian tubes. So when you swallow, it's totally normal to hear clicking in your ears that has to do with the opening and closing of those eustachian tubes. That's not the same as TMJ dysfunction, and that's a symptom that's often confused. So why would the jaw joints cease to function properly? Well, the simplest way to think about this is that you've been overloading those joints over time, and the structures are starting to have to adapt or change in order to configure themselves in a way that's going to allow you to go through the same habitual movement patterns, putting the same amount of stresses on those structures during your normal daily routine and activities, so that those structures can then withstand that activity. Now, we can think about this as good stress and bad stress. So let's say, for example, your teeth don't quite fit together very well, and you have to manipulate or move or wiggle your jaw around in order to get the food to go from big pieces into little pieces so that you can swallow it properly and digest it effectively. If your teeth aren't fitting together well, every time you chew, it drives one or both of your jaw joints into a position that might not be orthopedically stable, which means that something's going to change just a little bit at a time, and this takes a long time to happen. Most of the time, under normal circumstances, our bodies are built to be able to change and adapt over time, as long as the stresses and strains on those structures don't overload those parts, the ligaments and the tendons and the muscle tissue. Now, I'll share with you that in my experience, it's very uncommon for people to develop TMJ dysfunction problems or symptoms related to just the food or the diet that they eat, the food that they chew. Much more commonly, people develop these symptoms because they're doing something outside of the normal function of the jaw. Most common reason that I think many people suffer from TMJ symptoms is because we tend to hold tension in those muscles when we're uncomfortable. So think about what happens when you go outside and it's cold outside. Your muscles will tend to clench up. Sometimes you'll hear the analogy or metaphor of teeth chattering together because it's so cold. Sometimes that literally happens. But what I find personally is that when I walk out in the cold and I'm not warm enough, I'll tend to hold my teeth together really hard. Now that's called clenching. If we're doing that regularly and repeatedly, and we're doing it persistently over the course of a day, day after day, because we're constantly involved or engaged in uncomfortable situations, that puts a tremendous amount of additional strain, compressive load on the jaw joint structures. And those structures are not built to tolerate persistent compressive load like that. Those joint structures are built to tolerate the load that happens during chewing. So think about that. It's episodic. It's repetitive. It's clench and then let go. Clench and then let go. So this intermittent force that happens in jaw joints is very well tolerated over time. But these persistent stresses and strains that come from clenching and holding body parts in a static position for long periods of time are not very well tolerated by these structures. Now I should share with you here that the one direction of movement the lower jaw does not like to do, the jaw joints are not built to sustain this movement, is the direction of going backwards. What I would call retraction. What sometimes in dentistry they call retrusion. So anything that has you repeatedly retracting or pulling back your lower jaw, pulling back your mandible, is going to have a destructive effect over time on your jaw joints. So what types of things would cause those repetitive movement patterns to happen, these parafunctional activities to happen? I can tell you that it works best for me if I split these things into three categories. And I like to think of mental activity, emotional activity, and then physical activity. And if I just make a broad statement, a broad generalization that when we human beings are uncomfortable, we tend to clench our teeth together, then you could say, if I'm thinking about something and working very hard intellectually, mentally, I'm trying to solve a problem, you might be able to see that in the expression on my face. I might be clenching my teeth together or holding my jaw muscles together while I'm trying to solve that problem. That might be considered to be a form of stress. Now in the emotional realm, we all have emotions and feelings which make us uncomfortable. Think about walking into a room where you see somebody who you don't get along with very well. Somebody who might get under your skin. You might find yourself holding muscles tight. You might find yourself clenching your teeth or clenching your jaw while you're in the room with that person whose presence makes you uncomfortable. So there are many things in the world that'll create, elicit, or trigger an emotional response that could be said to be related to anxiety or stress. So there are emotional stresses for sure that will result in a physical change in the body, and I think this happens primarily through muscle activity. Now it's important to note here also that muscles that don't move regularly, that don't contract and let go regularly, tend to get into these patterns that can create what are deemed neurological symptoms a lot of times, like chronic fatigue syndrome or fibromyalgia or myofascial pain. Now, myofascial pain is a common diagnosis that we see in the realm of TMJ dysfunction. And I think the reason for that is because when these muscles of your jaw, which are primarily the easiest ones we can get to, the masseters here and the temporalis up here, when they get tight and stay tight for long periods of time, the muscles tend to hurt. They tend to fall into patterns of chronic pain. And then finally, there's the physical aspect of stress. So if you have aches and pains elsewhere in your body, let's say you have chronic back pain or a bum knee or chronic abdominal pain, these things can also cause us to feel anxiety and stress, and they tend to make muscles tight. Think about somebody who's having, let's say in an old movie, having a bullet taken out of their leg from a gunfight in a Western or something. What did they have them do? They would have them bite on a leather belt, or there's a common expression, bite the bullet, right? So the reason that we're doing that is because we're having to tolerate something that's uncomfortable. So these physical discomforts that we have also can create tensions and stresses within the musculature of the body, in particular here in the jaw muscles. So how can we solve these problems, and how can you overcome these symptoms of TMJ dysfunction? Well, for me, it's relatively simple in concept, but it can be difficult in practice. All you can really control is the period of time that you're awake. When you're conscious, you can draw your awareness to your physical body repeatedly over the course of a normal day. This doesn't have to take a long time, and this would fall under the category of, or the broad umbrella of, mindfulness. Be aware of where you are and how your body feels. You won't be able to do this 100% of the time, but you can check in periodically over the course of the day and decide, observe, witness whether or not there are tensions that have developed in these body parts, and do certain exercises in order to let them let go or release. So one of the things that I like to recommend to people is that over the course of the day, repeatedly throughout the day, whenever you remember, take a deep breath in through your nose, hold at the top for a second or two. When you release and exhale, exhale through your mouth. Like you're trying to blow on a candle flame without blowing the candle out. And then let that sit at the bottom for a second or two. It's also, in my opinion, important for you to pay attention to where your tongue is when you do the inhale and exhale. On the inhale, your tongue should be on the roof of your mouth. So you would press your tongue gently on the roof of your mouth and inhale. Hold. And then on the exhale, your tongue should come down. Your jaw should come forward slightly as you blow out gently. Do this as many times as you want over the course of the day. You may find yourself yawning, and that's perfectly okay. Now, another thing that you could do, that you could practice in order to create an awareness of what it feels like when a muscle is tight versus when a muscle is loose, or when a muscle has contracted or when a muscle has released. One of the things you could do with the jaw muscles is to clench your teeth together and feel those muscles contract. And then when you unclench or let your teeth come apart, you'll feel them let go. So you'll go clench, release. And get a feel or a sense. Really involve yourself, be engaged with the feeling of those muscles being contracted fully with great power. These are some of the most powerful muscles in the body. And then get a feel for what that's like when they let go as well. Focus on the letting go. Most of us have these kinds of problems because the muscles are too active and they're applying too much force to these structures. I have to mention here, though, there are many patients who I examine who I feel are the opposite. So remember, as I suggested in the beginning, we have to find a balance between being active enough, but not too active. There's a balance between on and off, or active and passive, contracted and released. So you have to still contract those muscles. If many people, when we get into pain, when we're feeling uncomfortable about something, we just won't do that thing anymore. So what happens with patients who go down that road is they'll often lose range of motion because they won't want to open past a certain point, and they'll only be chewing very, very soft foods. So whenever they have a meal, eventually those muscles lose mass and they lose power. So then people eat a normal meal and their muscles will get so fatigued and tired by the end of that meal or by the middle of that meal that they can't even finish it. And they'll end up in a pain cycle as a result of eating a meal. So in these cases, it could be very helpful to use a functional device, meaning practice during the day opening wide enough to eat something that challenges you. Eat something or bite into something that challenges those body parts right to the edge. You don't want to overdo it, but you do want to give yourself a little bit of a challenge. And when you chew food, really go slow and pay attention to what it feels like to chew on this side versus chew on this side. All of these things can help, and you don't have to take any extra time to do any special exercises. Just pay attention to your chewing and practice and exercise and get those muscles worked back to their full power just by doing what they're supposed to do. Now finally, the missing piece is what happens when you're not conscious. We spend about a third of our lives asleep. And when we go to sleep, we are no longer aware of what's going on in our bodies. And many people during sleep will go through cycles, periods of time, where these jaw muscles will be clenched very, very hard. The teeth will be squeezed very hard together. Sometimes the teeth will even be grinding together while somebody is sleeping. Whether or not there's a correspondence with dreaming is sort of unclear, but we do know that the grinding activity, the clenching activity, the repetitive muscle activity in the jaw muscles that occurs during sleep seems to occur more during the lighter stages and during the transitions between light stage and deeper stage sleep. So since you're not aware of what happens after you fall asleep, it's very important for most people with a form of TMJ dysfunction, especially those dysfunctions that leave you with compromised joint structures. If you have clicking or popping or grinding in your jaw joints, it's going to be very important for you to wear some sort of a device, which I would usually call an orthotic, to protect those joint structures from that muscle activity, which is going to occur, that you can't do anything about. So the combination of these things, of being more aware when you're awake and protecting those structures with some sort of an orthotic, preferably a very well-made orthotic while you sleep, is the most effective tool, the most effective management system I've ever found to help people who have TMJ dysfunction and the symptoms that come along with it recover from that, overcome that, feel better, function better, and move on with their lives without having to worry every day about whether or not they're going to be in pain after their next meal. So I hope you find this video helpful. If you have any questions or comments, please leave them below. I will do my best to get to them when I can. If you like this sort of content and you want to see more videos like this, please hit like and subscribe below. Thanks for being here. I'm looking forward to talking with you again. My name's Dr. Jeff Dolgus, and I'll see you next time.